We are covering the inpatient phlebotomy workflow, a critical topic for your phlebotomy exam. Exam questions often test your ability to navigate the hospital environment efficiently and safely. A major part of this workflow is the early morning rounds, typically conducted between 4 and 6 a.m. The exam will test your understanding of why this timing is crucial. It's to collect fasting specimens for tests like glucose and lipid panels before the patient has breakfast. Accurate results for these tests depend on an 8 to 12-hour fasting period. Your exam might present a scenario where a patient has a fasting order but tells you they just drank orange juice. The correct action is not to draw the sample, but to notify the nurse and document the situation, as the sample's integrity would be compromised. Another critical area tested is patient prioritization. Imagine you have 3 orders: a routine CBC, a stat potassium, and a fasting glucose for a patient in contact isolation. How does the exam expect you to proceed? You must always prioritize the stat or immediate request first. Stat orders indicate a medical emergency where results are needed urgently for diagnosis or treatment. After the stat draw, you would handle your routine collections. The exam expects you to draw the patient in isolation last. This rule is in place to minimize the risk of cross-contamination to other patients and to yourself. Infection control between patient rooms is a heavily tested concept. After every patient encounter, especially with an isolation patient, you must perform proper hand hygiene and change your gloves. Your cart and any reusable equipment, like a tourniquet, must be disinfected. A common exam trap is a question asking for the first thing you do after leaving a patient's room. Always look for an answer related to hand hygiene, as it is the single most effective way to prevent the spread of infection. Finally, communication with nursing staff is paramount, and your exam will reflect this. You might encounter a question where you need to draw a timed specimen, such as a peak and trough level for an antibiotic. The correct procedure requires you to coordinate precisely with the nurse to ensure you draw the blood at the exact specified times relative to the medication's administration. Similarly, if a patient seems confused about their NPO status, or if you cannot confirm their identity because of a missing wristband, you must communicate with the nurse before proceeding. To remember the core workflow, use the mnemonic SISC. Stat first, isolation last, sanitize and stock, and communicate with the nurse. This simple phrase can help you correctly answer scenario-based questions on your phlebotomy exam. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.